Hello, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria Stone-Ozbek, and tonight we have a very special guest, Miss Mariah Alyce. And
Hi.
she is going to be talking to us about all things birth and being a birth worker in the year of 2020, and how to keep mom healthy pre and post pregnancy. So, welcome, Miss Mariah.
Hi, how are you?
I am good. How are you doing?
I'm doing well. Thank you for having me.
Well, you know what? I just want to thank you so much for taking time out of your busy schedule to, come on and bring some insight into, just being a birth worker and how we can benefit from your services.
Thank you.
So first, let's start out by telling the people a little bit about who you are and what you do.
Okay, so my name is Mariah Alyce Brown. I am a doula, a certified lactation counselor, and a placenta encapsulation specialist. I will be going into my first cohort for midwifery school in January, so I'm super excited about that. And I do all things pregnancy, reproductive health, and postpartum healing as well.
Oh, nice. Yeah. So a lot of people skip over the postpartum health, but to me, that's one of the most important parts um,
It is.
that you have to take care of, after giving birth. So tell the people a little bit about like what is a doula?
Okay. So a doula is someone that provides emotional, educational, and sometimes even physical support. We do a lot of educating during the prenatal stage so that we can help to prepare mom for labor and the birth and postpartum as well. And then you also have doulas that are postpartum, and they focus more so on just being able to help you during that postpartum healing phase, providing, just that extra special attention and support that we need during the postpartum stage.
Yes. Yeah. So I think a lot of people sometimes get being a doula and being a midwife kind of confused a little bit. So can you tell us what's the difference between a doula and a midwife?
So a midwife is more medical. So those are the ones that are actually assisting with catching the baby, right?
Yes.
So those are the ones that are more so like a provider. They do more of like just ensuring that everything goes well as far as the labor is concerned on the medical end.
Yes.
And then for the doula, we're more of like emotional, mental, and like I said, educational support, helping you to be able to make educated decisions regarding whatever it is that you want for your birthing plan.
Yeah. So essentially they work well together.
Together, we work very well together. So I kind of really don't like to compare the two, but if we were talking on a medical standpoint, it would almost be like the doctor and the nurse.
Mhm.
Um, just really being able to support and help, and make sure that mom is safe and her needs are being met.
Yes, yes. Oh, it's so awesome. I'm so excited. My friend, she just gave birth a couple months ago, and she had a midwife and a doula, and she had a home birth. And so it was just, just so awesome to kind of hear those stories and stuff like that as well. So you are also a lactation consultant.
Counselor, lactation.
Counselor. Okay. Counselor.
Yes, 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 yes.
So, what are some issues that you think or that you would say new moms have when it comes to, lactating and, trying to breastfeed their child?
Right. So one of the biggest issues that I see is not really having the support or the education, right? So
Yeah.
support and education go hand in hand. It's kind of hard for our family members to support what they don't really fully understand.
Yes.
So just not understanding the significance and the importance of breastfeeding sometimes can throw a curveball, especially when you need someone to back you up
Yeah.
in why you're breastfeeding. It's hard to breastfeed when you have a million people telling you why you shouldn't, and it's easier to formula feed. Uh,
Yeah.
but when they know and understand why, you're breastfeeding, and they understand that it's not only healthier for the baby, but it's also healthier for the mom, it makes a world of difference.
Yeah.
So education and support are definitely key. And again, with education, also the education and understanding that, just because you had a baby, the floodgates are not just going to open.
Yes.
I think a lot of moms just expect, like, oh, I had a baby, but my milk isn't coming in. Your milk is there. It's
Yeah.
just you're expecting for it to flood and pour out, and it doesn't happen like that. So it's really important for me to try to educate those moms before baby gets here, so that they kind of know what to expect, and they don't, go into shock if it doesn't happen the way that they thought that it should happen.
Yes. And it's so important too, like even if you're not the woman, it's important for the spouse to be
Right.
there and to be supportive as well, because it is so frustrating. And a lot of people, they don't even realize how frustrating it is, but it is super frustrating trying to get that baby to latch on. And then it's like painful as hell if they like latch on the wrong way.
Right. And that's another thing, right? Knowing that it shouldn't be painful, right? So if it is painful, why is it painful? Is baby's latch just incorrect, or are there other issues? Other issues could be a tongue tie or a lip tie.
Yeah.
Um, and one thing I've learned about a lot of people that I see with a tongue tie and a lip tie, it causes speech impediments or speech delays. And
Yes.
so those are things that we kind of should know a little early on, because those are things that we can correct and be proactive in to assist for, those things that come on later in life, like speech.
Yes, definitely. That's so true. I remember, and it's been a long time ago, okay? Because I told you my daughter is 12 years old.
That's not that long.
But I'll never forget, I was in the hospital and I was like, I'm gonna breastfeed this. I researched it. This is the best thing for my baby. And I was just having such a hard time, because like you said, my milk wasn't coming down, like I thought it should. I felt like it should, come, faster.
Right.
So, and my mom was there. She was like, just give the baby a bottle. And I'm like, no, I want to breastfeed. So it was just, you're already emotional, your
Yeah.
hormones are all over the place. And then it's like, and you're trying to, do the best thing that you want to do for your baby. Someone
Right.
asked, how is breastfeeding for mom healthier?
So, breastfeeding for mom actually decreases your chances of postpartum depression. It decreases your chances for ovarian cancer. It decreases your chances of uterine cancer and breast cancer. But it also assists the uterus with contracting back down to size. So that's important, because you know how the old people used to say, after you have a baby wide open, you literally are.
It makes you snap back, girl.
Yes, and it really helps that uterus to contract back down to size, which speeds up your postpartum recovery healing.
Yeah.
And hey, I mean, I'm all for burning extra calories and not really having to work
Oh,
out. So it
yes.
does as well.
But
Mhm.
you know what? A little thing that I used to do too that my mom would always say, once you have the baby, you have to put on what they call a panty girler to kind of like, compress that stomach in. And
Yes,
that also helps your stomach to go down as well. So
it
I
does.
know that.
It does, and I see a lot of girls who have absolutely no idea what I'm saying when I'm like, "Do you have a belly binder? Do you have a girdle?" These are important, a lot of things we think is just old wives' tales or just, old traditions, but a lot of those things are very, very, very important, as far as our healing goes.
Yes, that's so true. Like I'll never forget that. Another thing too, like what are some things that you see like when, women are trying to breastfeed and sometimes the ducts are clogged up? What are some ways that they can, relieve that pressure from the clogged ducts in the breast?
So many different things, right? So for one mistake that I often see is girls using the breast pump right after they have a baby, right?
Oh.
I discourage that, because that triggers overproduction, and that's where you're seeing a lot more clogged ducts. That's where you're seeing a lot more mastitis and engorgement, because your baby's suction is a lot more powerful than that pump, right? So baby is sucking and making sure to move that milk so that those ducts aren't getting clogged.
Yeah.
But if you do have a clogged duct, one of the easiest things that I tell my clients to do, get a vibrator and massage that breast area. It
Yeah.
literally will loosen up that milk and allow it to flow out, or just applying a warm compress to the breast and massaging it out and then going ahead and trying to feed.
Yes. Someone asked, is it true that a baby can be allergic to their mother's breast milk?
No. So here's the thing. Baby could possibly be allergic to something that mother has ingested. So you want to be very careful about what you're eating. For a lot of, well, I'll say for African American people, we are typically lactose intolerant. So I definitely suggest considering removing dairy from your diet initially, but then just paying attention to the things that you do eat. If you do notice that there's an allergic reaction, see if it's nuts or pasta, red sauce. Just
Mm.
pay attention to the things that you're eating.
Yes, I also read a research article that if you introduce dairy into the baby's diet within the first 6 weeks, they are more likely to develop allergies.
Hmm.
I thought that was very interesting because I didn't really, realize that before.
Yes, and I'm a big cheese eater. Cheese is my kryptonite. But as far as milk is concerned, I'm not really big on milk unless I'm having cookies, right? But I have
Mm.
noticed that like even just that little bit of milk, it creates so much like mucus
Yes.
within your body.
Oh my God.
And we don't even realize it until something's wrong. And then we're trying to, oh, well, what did I do? Well, what did I eat? What
Yeah.
did I inject? We don't even think about that.
Yeah. Someone asked, what are your thoughts on breast milk banks? So, if you need donor's milk or something like
Okay.
that.
So breast milk banks are they're for people that really need them. I think that they are a great alternative option. Um, yeah, they're great. So I guess
I mean, if you need it, you know.
absolutely. If you
But
absolutely need it, definitely do it. There's absolutely nothing wrong with it. The milk is safe. The milk goes through processing. They make sure that there's nothing wrong with the milk and everything. So I guess the reason I was kind of a little hesitant is because it's interesting to me that people are open to milk banks, but we frown upon donor milk from moms that we know or from other moms feeding, right? When traditionally, that's what African American women did. We were wet nurses. We
Mhm.
were wet nurses. We fed everybody's children. And so it's interesting when people are more open to milk banks, but not as open to community milk.
Yeah.
From those around them. But I'm definitely all for donor milk from the milk bank. If that's something that you need, definitely utilize that resource.
But if you can breastfeed your own baby, it's the best because your body actually
Create the
milk,
antibodies.
yes, the milk, your body just kind of adapts to whatever. It's like if your baby is sick, your body can adapt and give your baby the nutrients that they need to fight
Absolutely.
that infection or sickness off. So
Absolutely.
definitely use your own tatas, ladies, if you can. So another thing that you also do is placenta encapsulation.
I do.
Now, Mariah.
I love it. I love it. And
Oh my
everybody
God,
always gives me that look when I say
please
it.
educate us on this because when I think about ingesting my own placenta, baby, I want to puke. Okay.
No, but you have to keep in mind like all of the necessary vitamins and nutrients that you lose during childbirth. A lot of things. And for a lot of us, well, for African American women, we tend to be anemic, severely anemic.
Yeah.
That's iron is something that is very, very, very necessary, right? And so with placenta encapsulation or however you decide to have your placenta prepared to ingest, it really does help restore those important nutrients, vitamins, and it also helps with balancing out those hormones. So you know how after you have a baby, it's just like hormones are just weird and you're just
Yeah.
all over the place, right? This kind of helps you to balance it out. There also have been some studies that say it assists with the increase of milk supply as well. So I'll be honest, I don't really have anything to compare it to because I know if you move milk, you make milk. But I have had a lot of moms that say they noticed a huge supply increase with that encapsulation as well.
Wow. Do those little cookies, lactation cookies, and all that stuff, does that help? Because I don't think that was around when I was when Justice was little.
So it's tricky. You'll see some people that say that it does help, but that's the same thing that I hear a lot about the different drinks and stuff, right? You hear, oh, drink Gatorade or
Yeah.
drink what's the one, Body Armor or something, right? If your body reacts to that, it's because it's a nutrient that's in that you needed, and it just took what it needed from that, right? So with Gatorade and Body Armor, your body was dehydrated. You really needed water, and you would have had a better response with drinking water, but you drank Gatorade and Body Armor instead, which is totally fine. But we do want to be diligent in making sure that we're consuming different things the right way instead of going about trying to do a quick, easy fix with something that could potentially actually decrease our milk supply.
So how do you I can't try to wrap my mind around it. How do you prepare the placenta for encapsulation? Like, do you have to put it somewhere? Has to dry it out, grind it up? Like, how does that work?
So I actually pick up the placenta and I'll process it, clean it, make sure that it doesn't have any contraindications that would, make it not a good idea to ingest it. I also do placenta tinctures. So the tinctures are great because even later on when your period returns, they assist with, those cramps and hormonal imbalances that you are experiencing then. So I'll do that. And then I do dehydrate it and prepare the capsules. I also make cookies, chocolates, brownies. I can do a broth with it because I do steam all of them. I can do a broth and then add in veggies and different herbs that assist with postpartum healing as well. Because, in postpartum, you're supposed to be eating soul food, hot foods, warm foods, not salads and not, smoothies and things like that. We need to be keeping the body warm and not allowing anything cold to enter the body for the first 40 days to assist with making sure that the body is doing what it needs to do to heal properly.
Wow. Oh my God. I'm like, my mind is blown right now. Like,
It's a lot. It's a lot.
I'm in a few mom groups and things like that. So, I always read this stuff and I always hear about it, but it's always just kind of gone over my head. And I've never really considered like doing that.
To be honest with you, I had never heard of placenta encapsulation until I actually stepped into this realm. And then just doing my own studies about, the importance of it, the significance of it, why it's important, why it's necessary. And then going about, making sure that I'm doing everything I can to educate moms that really truly want to do everything they can to make sure that they're, healthy in the postpartum stage. And those are the things that really do help with postpartum healing.
Yes, definitely. Someone asked, how long will the placenta last once you make it into food or into the capsules?
Okay. So the capsules are actually good for up to 6 weeks postpartum. The tinctures, because they're alcohol based, they never lose their power. So you can use them until the end of time if you wanted to. They would never lose their strength. They would never go bad. As far as the food, you're still looking at a 6-week cutoff as far as the food is concerned, because you do want to make sure that you're keeping it at a really good temperature. Like it has to be kept at a good temperature to make sure that it doesn't go bad or spoil.
Yeah, and I'm sure the faster you consume it, the more nutrients you will probably get out of
Right,
it.
right,
Yeah.
right.
So that makes sense. That makes a lot of sense. So what would you say are some of the common misconceptions about being a doula? Like, do people try to put you in a box?
Right. So I think one of the biggest misconceptions I've had as far as being a doula is people just assuming that a doula takes over the role of mom or spouse. And that's not at all what it means. Like I said, I do a lot of educating, but I also educate the family, right? Because if this is something that you truly want, your family has to understand it so that they can fully support it and so that they can advocate for you in the event that you can't advocate for yourself. And I
Yeah.
know that's something that a lot of people don't think about, but realistically speaking, there's always the chance that you could lose your voice. Not necessarily lose your voice, but you could be put into a position, emergency C-section or something, put under, and you can't speak for yourself. So the people that are on your team, they need to understand what's going on, what's the significance, why does she want to do this, so that they can speak for you. I also do a lot of teaching them like the physical part of it as well, because no matter how comfortable you are with your doula, you feel more safe in the hands of mama or your husband,
Yeah.
right? And so when you feel safe, you're able to relax, you're able to be calm. And when you're able to be calm and relax, it allows your labor to go a lot smoother than it would in a high stress situation.
Yes.
Mm-hmm.
That was one of the things I think when before I had Justice, people were saying, "Oh, it's your first child. You're going to be in labor like 24 hours." So I was like freaked out. And she came in like 6 hours. Like I went in labor at like 1:30 in the morning and she was here at like 7. So it just went by to me so fast.
Mm-hmm.
Almost like a blur.
Now, I will say I have had quite a few labors that have gone by fast. I've had some that baby got here in 2 hours, and I was like, "Whoa!" If all of my births could be like this would be great. But
I know.
I've had some births that have lasted 24, 48 hours. So
Mm.
it just kind of depends on, honestly, a lot of it more so depends on like environmental things. Like, are you relaxed? Are you calm? Are you able to get up and be mobile and stay upright? Those types of things are kind of important.
Yeah, and a lot of people don't realize too that sex will make the baby come a little easier, a little smoother too.
It
So
does.
don't try to deny your partner.
It helps with safety. Right. Like I'll have girls that'll be like, "Oh, I just don't feel comfortable." And I'm like, "You want that baby to get here? Get to it." So it really does help. Like you said, it helps with effacement, it helps with dilation, but it also helps release oxytocin, which is one of those hormones that you need to assist with steadying out those contractions so that we can have a productive labor.
Yes, definitely. Someone asked, how are you managing being a doula during COVID? Since, most hospitals only allow one person in during the birth.
So, I've been blessed. So, for one, Princeton Hospital in Birmingham, they've actually been recognized as one of the nation's top hospitals for maternity. They allow your doulas to come in. They actually recognize us as a part of the birthing care team. So, I've not had any issues with them. As far as everyone else, my home births, of course, I 100% attend those. And then the ones that I can't attend as far as going in, I either go in with the mom and labor down with her at home, which is something that I definitely recommend you laboring down at home if you can.
Down. We'll come back to that. Go on.
Yeah. So laboring down at home, and then we'll switch over to virtual service. So I offer where I can be on the phone with dad or mom, and then, or if they want to do video call, we can set up a video call as well, and I can kind of coach from the side.
Mm-hmm. Now,
Mm-hmm.
back to this laboring down. What is that?
So laboring down is when girls freak out, they get those contractions and then they're like, "Oh, I'm contracting. I need to go to the hospital."
Yeah.
And then you'll see some women that are in the hospital for 24 hours. You could have stayed at home and labored down. That was the earlier stages of labor. We really recommend you staying at home as long as you can until it's necessary to go to the hospital.
Yeah.
Especially for us, because what tends to happen is we tend to get so high stress, right? And then we shut down. I don't know about you, but I know for me, I have white coat syndrome. So I associate the hospital with sick people and dead people.
Oh, no.
And so for a lot of women going to the hospital because they have the same mindset, it can slow your labor down. Which is why we definitely recommend, if you're not having control, if you're close enough to the hospital and you can get to the hospital in a decent time, I definitely recommend staying at home until your contractions are 5 minutes apart.
Okay.
Now, then you have women that say, oh, well, what if my water breaks? Well, your water breaking, scientifically, that only happens for 10% of women. A vast majority of women are having their waters broken by the doctor.
Yeah.
So you literally can stay at home until those contractions are about 5 to 7 minutes apart and then transfer to the hospital. It decreases your chances of needing an epidural. It decreases your chances of being sectioned for a C-section that's not medical or necessary. It also decreases your chances of anything going wrong with the baby. So when you start talking about oxygen levels dropping, when you start talking about heart rates and things like that, typically those are directly related to Pitocin and epidurals.
Yes. And you know what? One thing I think a lot of people don't really talk about is that after I gave birth, my hair shed so bad. And I know it was because of the epidural. And when I tell you it came out so bad, I would just like brush my hair and it would just be
come out.
lots of hair. Or I would wake up and it would be so much hair on the pillow from the epidural. And I didn't realize that was like one of the side effects, which I'm sure it probably doesn't affect everyone, but
yeah, postpartum shedding is a really big concern for a lot of people. It also has a lot to do with the hormonal imbalances as well. But like you said, when you start throwing in all of this other medicine and stuff, you really can't even pinpoint what's going on with your body. You really don't even know what's in your body.
Yeah.
And realistically speaking, I know a lot of people are concerned about the pain aspect, but I have seen far more women, like when you come to the realization that you're having actual contractions that are not being induced with Pitocin, which is what they do at the hospital, they're a lot more manageable, lot more manageable.
Yes.
Did you just think about those contractions?
I thought about something. We were going to talk about the use of unnecessary C-sections rising. A lot of moms are being told that, hey, you need to do a C-section, and they schedule it out because they got a vacation coming up the next 2 weeks. So, we want to try to avoid unnecessary C-sections as much as you can. Like if you, you don't have, of course, medical issues that require you to have one. I would say if you don't need one, try to kind of wait it out. Just because you have a due date, that doesn't necessarily mean the baby is ready to come at that time. He or she may need a little bit more time to cook in there. You know what I mean?
Right. But a lot of people don't even know that 38 weeks is not full term. That is not full term. I don't know where we came to thinking that was a full term baby. It's not. Full time is 39 weeks to 42 weeks. So you could actually be off by 2 weeks. When you're talking about your conception date, are they going by the measurements? Because then you'll start hearing, oh, your baby's measuring 2 weeks ahead, or oh, your baby's measuring 2 weeks behind. Still an estimate. You know what I'm saying? Still an estimate. Even when you go by your last period, or even if you think that, oh, well, I know the day that I conceived my baby. Well, science shows us that conception could be anywhere from 7 to 14 days.
Yeah.
Just because you had sex on the 13th doesn't mean you conceived on the 13th.
Yeah.
So that's where you're seeing that huge difference in the timeline. It literally could be 2 weeks off. And so it's very important that women realize your body is holding on to your baby because it's supposed to. I guess what kind of also kind of throws me into confusion is like, we push women to know that your baby has to cook for 9 months, right? But then we try to rush the last month.
Yeah. It's like, get it out. All right, I'm done.
Right. But so brain development is important and it's happening up until the 40th week.
Mhm.
Now if baby comes on their own, we do have, issues where we have premature births, right? And those are other underlying medical conditions that could contribute to that. But another one of the biggest, two of the biggest concerns I see as far as prematurity, one, dehydration. You're
Mm.
not drinking a lot. If you're not drinking enough water, you could cause yourself to go into preterm labor. A lot of people don't know that.
Yes.
The second issue would be preeclampsia. Preeclampsia can literally be controlled through your diet and exercise.
Mm.
It's a condition of high blood pressure.
Yeah.
So we can't eat fried chicken every day. We can't eat, fast food every day. We need to be eating foods with substance to make sure that, this is a viable pregnancy and we're getting all of the nutrients that we need and our womb is being kept warm.
Yeah.
Warmth in the womb is a real thing. So those are just things to consider when you're talking about those due dates. It's like it's a lot of factors that are thrown into there,
Yeah.
but we definitely want to be shooting for that 40th week, not that 38th week.
Yes, and then also too, as a chiropractor, a lot of people don't know that chiropractic care can help women who are pregnant.
Yep.
If you have a breached baby, we utilize a technique called the Webster's technique,
Mhm.
and the technique does not turn the baby as most people think, but what it does is it aligns the pelvis and gets everything in proper position so that your baby can have enough room to turn on its own. And so that's one of the things that we do offer as chiropractors. Someone asked, do you support mothers who have experienced miscarriages?
Absolutely. Absolutely. That's actually one of the things that brought me into birth work was working with a mother who was having issues with viable pregnancies. And then once she did have a viable pregnancy, you're put on that list of being a high risk pregnancy. And
Mhm.
so I absolutely, I've actually found myself working more with high risk women than those that are not. So
And
absolutely.
what do you think are some reasons that you have heard of that have caused women to have miscarriages?
So realistically speaking, I think we haven't been taught that that is something that sometimes just is a natural thing. It just doesn't stick.
Mm.
A lot of people just don't talk about miscarriages, right? But it's far more common than a lot of people think it is. But a few things that I do think add to issues, one being birth control. A lot
Mm.
of us were on birth control before we even started having sex. That's an issue. Not being really taught how to treat our wombs and how to be kind to our wombs and how to take care of our wombs. That's another thing, right? So even when I talk about warmth of the womb, right? A lot of people don't even know how to properly take care of themselves when they're on their periods.
Mhm.
That's an issue. And that could contribute to other issues later on. Another issue would be STDs. A lot of us, may have come into contact with an STD that we don't even realize we know because sometimes they don't show signs, right? Those could interfere with fertility as well.
Mhm. And also too, your partner can contribute to, you having a bad pH balance
Right,
in your, vagina as well. So, um,
right.
maybe we should do a show about, proper cleanliness and how to take care of, our JJs.
It's very important. Like even when you're talking about warmth in the womb, right? I used to think my mom was crazy because she stayed on my head about wearing socks on my feet.
Uh-huh.
But that's a real thing. Making sure that your extremities are always kept warm, your head, your hands, your feet are kept warm because those are directly related to your womb. So when you think about your cramps and your clots, what's the first thing we run for? A heating pad
Mm.
because we're trying to keep our womb warm. We could literally just put on socks, put on a hat, get up under some blankets and eat some warm food and drink some warm tea or some hot chocolate or something. Those will literally make a huge difference out of the way that your period experience is.
Yes, definitely. Because when I was younger, I used to get cramps so bad. And if you're a dad out there, listen up. I used to get cramps so bad, I used to throw up.
Mhm.
And I could not understand why. And to be honest, it really didn't decrease until after I had my daughter.
Mhm.
And so I just always thought that that was kind of, interesting to
The
explore.
same care that you should be taking for postpartum is the same care that you should be taking every month when you have your menstruation cycle.
Yes. Yeah. So do you have like a routine that you recommend to new moms that they can just kind of do to just kind of get the ball rolling to like health and healing the womb?
Um, so like I said, definitely making sure you're having warm food. One of the biggest things that I tell my clients is meal prepping. Meal prepping will become your best friend. And when I say meal prepping, I mean you and mama and grandma or whoever get in there and make you some soup. Make you some soulful soup and put them in the freezer. That way, when you come back from having your baby, all you're having to do is pull that out of the freezer, warm it up, and you have a meal.
Yeah.
So meal prepping definitely will become your best friend. Drinking warm teas. One of my favorites is nettle tea. Nettle is very high in iron, so it assists with anemia, and it tastes good, right? So nettle tea is definitely one of my favorites. And another thing is just making sure that the people that you have around you during your postpartum stage, making sure that they are aligned with the same values that you have as far as what it is that you want your outcome for your postpartum stage to be.
Yeah.
Um, so anybody that doesn't agree with you breastfeeding your baby, you might want to rethink having them around your baby. You know, I don't want, if I'm giving you my breast milk, I don't want to come home and my baby's eating cornbread and collard greens,
Yeah.
because that's the problem. Or, and not even necessarily just, it is a health problem. There's a health risk for that. But also just considering the fact that this is my child and that's direct violation. Like,
Yeah. Don't even get into that.
and that could cause a lot of unnecessary stress as well. And we don't need
Mhm.
that during the postpartum period. That's a time of healing. That's a time of bonding. Stress will definitely be a part of it because there's a crying human. But it doesn't, you don't have to have the unnecessary stress of having to argue with somebody about choices about your child.
What do you say to the old heads who always say, "Oh, you need to put some cereal in that baby bottle"? Your baby won't go to sleep all night.
Yeah. So cereal, what I will say is I don't want to discredit anyone that has raised children right before us, because they did what they had to do to
Yeah.
make sure that we had what we needed, and what was necessary to make sure that we live viable lives, right? But living life and living a healthy life are two different things.
Yeah.
And so I think that it's important that we apply education as we're getting these new studies and these sciences, and we're learning that this is not healthy. We need to apply that. We also need to consider the fact that cereal from 1990 is not the same cereal in 2020.
All right.
It's not the same. There are all kind of microbes in that formula. I mean, just think about how much they're recalling formula now.
Mm.
Every year you're seeing a recall on stuff, but you know what they're not recalling? Breast milk. And
Yeah.
you know what doesn't cost $40 a can? Breast milk.
All
So,
right.
those are the types of things we need to be considering. And then as far as like I said, cereal is not necessary. You literally could go from breast milk to introducing your baby to pureed foods or maybe even solid foods, right? And even with baby food, if you're cooking peas, put it in a puree and give it to your baby.
Yeah,
Get
and they even make the little blenders now that you can buy at Babies R Us. You can just put that stuff in there.
listen, because I'm all about saving a coin. Throw them peas in there.
I need all the coins.
Throw them peas in there, puree it. But you do want to make sure that you're waiting at least until baby is 6 months or able to sit up on their own before you start introducing foods, because it does create an issue as far as gastrointestinal issues, acid reflux. Baby spitting up, everybody thinks that's normal. It's not. Baby spitting up is literally a sign that something is wrong. Either your baby has acid reflux, your baby is allergic to what you're feeding them, or your baby is being overfed. And those are all issues,
Mm.
and so we need to consider those things. When grandma's telling us to put cereal in the baby's bottle. And also considering, babies are not supposed to sleep throughout the night. They're not supposed to sleep like that. And I think we get into this thing of thinking, okay, this baby is crying too much. I need this baby to go to sleep, right? But do you sleep 10 hours a day?
Depends on how tired. No, just kidding.
And even then, you also want to consider like the rate of SIDS. You know
Mhm.
what I'm saying? My baby not waking up in the middle of the night is gonna scare me because SIDS is still prevalent. And one of the factors of SIDS was actually linked to babies being overfed with formula. So
Wow.
those are important things that we need to know, we need to understand, and we need to consider.
Yes, and also too, another thing too, a lot of people are like, "Well, I didn't know chiropractors can see newborns." Like,
Mhm.
why would you need to even see a newborn baby? And a lot of times, the birthing process can be traumatic on the baby, and even though you may not look at it that way, it is a traumatic process. And you got to think about it. They're pulling that baby out by their
Right the
nose.
head.
You know what I mean? How can that not be traumatic? And so
Mhm.
I have seen babies who have been like, just their muscles are just so tight they can't even relax. And
Mhm.
I would just adjust them, which is not the same as adjusting an adult. Let me just clarify that.
They typically sleep right through them. It's
Right through
not painful at all.
adjustment. Yes. And so I see them relax almost immediately on the table. You know what I mean? And
Mhm.
so it's like, it's just go and let them see someone. It won't
Right.
hurt.
And chiropractic adjustments for newborns, they can help with latching, like babies that are having issues with
Yeah.
latching. They help with sinus issues, babies that are having issues with sinus, colic. That's
Mhm.
big, and even
Patient.
and sometimes y'all's babies won't sleep because they're just uncomfortable, and it
Mm.
really helps with it.
Yeah, and there sometimes what I find too is that the sympathetic nervous system is just like fired up. And so once I adjust that, I'm directly affecting that sympathetic nervous system, which causes the baby to relax. You know what
Mhm,
I mean? So
mhm.
someone also asked, what are some signs of a baby that is malnourished?
So I guess you would be looking at the frequency of feeding, for one. But I guess my question for that would be also, what are they eating? Because malnourished babies, I mean, that's not
It's
something you
common
typically
in the
see
US.
unless you're just skipping feedings. Yeah, unless you're just skipping feedings because babies are getting what they need from breastfeeding. I know for a lot of people, it seems like, oh, well, this baby's only eating 2 ounces. That baby should only be eating 2 ounces.
Mhm.
For every hour that you go without feeding, that's how much of an output of milk you should be receiving. So if on average you're going every 2 hours of doing a feeding, you should only be feeding your baby 2 ounces.
Yeah.
Um, Babies eating 8 ounces of milk. It's kind of, I mean, I even my babies that are 2 and 3 years old that are still breastfeeding are not eating 8 ounces of milk every feeding for breast milk. You also have to consider the fact that breast milk and formula milk is not the same. There's a lot of fillers that are in formula milk, so it does require more formula for them to get full than it would if you were feeding them on the breast as well.
Yes, definitely. That's true. Because you don't really see too many babies in the US that are malnourished.
Mhm.
But sometimes when you go to third world countries where they may not have, access to a lot of healthy foods and things of that nature, you're more likely to see, malnourished babies.
Right. So like food desert areas, and people that don't have access to water. Honestly, you can feed your baby along on water. Water goes a long way. A lot of people don't believe me until they actually start paying attention to their water intake and they notice that they have a huge like surge in the milk output just from drinking water.
And what are your thoughts on giving babies water?
Water toxicity is a real thing. So I don't. Now I will say you also so hind milk and fore milk, your baby is getting the water that they need from the breast.
Okay.
So now I'm really not big on water. Your baby literally is getting what they need. I know that sounds crazy,
No,
right? Because
it
you
don't.
to drink water, but mm-mm.
No, I like it doesn't sound weird. I definitely understand what you are saying. So But
And you also want to be careful about, like, I don't think people realize what all is in the water, right? So even when we were in school, fluoride is in water to help your teeth. And
yeah.
we're consuming it from tap water, or even like if you look on the bottle of water, a lot of these waters have a lot of like a high sodium content
Yeah.
or other things that are in the water. So those are things that you want to be careful of because your baby's gut flora is not mature enough to be able to break down and filter out things like you can as an adult.
Yes, definitely. Oh, well, I just want to say you have blessed us with a ton of information for tonight. Do you have any like closing remarks or anything else you want to kind of slide in there before we go?
No, nothing much besides, like I said, I'm a doula, certified lactation counselor. I'm entering my first cohort as a midwifery student in January at MCU.
Yay.
And I am excited and so ready to help our community.
Yes, definitely. And also, too, if you need to get in touch with Mariah, her website is www.mariah, MariahAlyce.com. Her number is 205-462-8959. And her Instagram is OHMI_OHMYDOULA. So be sure to hit her up for all of your prenatal, postnatal, postpartum needs.
All of it. All of it.
Take care of you. And also make sure to tune in to Random Health Ish every Monday at 7 p.m. Central Standard Time. And make sure that you subscribe and like our channels. You can follow us on all platforms at Random Health Ish. Okay. Thank you guys so much for tuning in. And I hope you guys have a blessed evening. So
Thank you. Happy holidays,
happy
everyone.
holidays.